Knock, knock, knock. From the hand hygiene. Hi, I'm Emily. I'm a student nurse from Harper. I'm here to do an assessment of your eyes and ears. How are you today?
I'm doing great.
Alright, so I'm going to first off start by asking a couple questions. I see you have glasses on. Could you tell me what they're for?
They're for my nearsightedness.
Okay, and how long have you had them?
Since I was 8.
Okay. And then have you had any tinnitus or ringing in your ears recently?
No.
Okay, good. So the first thing I would do to test cranial nerve number 2 is use of the Snellen eye chart, which I don't have right now, but if I did, I would have my patient stand 20 feet away and ask him to read off a certain row of letters with both eyes, with his right eye covered and with his left eye covered. And I interpret the results as 20/20 being normal. If he were to say get a result like 20/30, that means he is able to read at 20 feet what someone with regular perfect vision could read at 30 feet. Okay, so next I'm going to test cranial nerve number 2 again with your peripheral vision. It's a confrontation test. So I'm going to sit down with you. And you're going to cover one eye, and I'm going to cover this eye for comparison, and you're going to tell me when you see my finger, okay?
Okay. Alright, I see it.
Okay.
I see it.
Okay.
I see it.
Okay. And switch.
I see it.
Okay.
I see it.
Okay.
And I see it.
Okay. So he was stating he saw the finger at the same time I was seeing my own finger, which is a normal finding. Okay, so then next, since I'm at eye level with you, actually, I'm going to look at your 6 cardinal position of the eyes. So I'm checking your oculomotor nerve, the trochlear nerve, and the abducens nerve.
Okay.
So just follow my pen and, okay?
Okay.
So his eyes move bilateral. There's no signs of extra movement like nystagmus or and he's able to follow the direction easily and smoothly. So good job.
Thank you.
Okay, and then I come and I look at his eyebrows. They're symmetrical. His eyelids, there's no redness or swelling, and his eyelashes, they're evenly distributed. His sclera is white, and then if I pull it down and look up, his conjunctiva is pink and moist, which is normal. And I'm going to put the pen and you follow. So that's accommodation. His eyes converge towards his nose, and his pupils constrict with accommodation. All right, now I'm going to test his light reflex. So I'm going to shine a light, okay? So what I'm looking for is just constriction of the pupils. So that constricts, and I want them to be bilaterally constricting. So both of them constrict. And his eyes are brown. His pupil size is about 3 to 5 millimeters, and his eyes are round shaped and symmetrical. And so I would write this as PERLA. So pupils are equal and reactive to light and accommodation, which is a normal finding. Okay, and the next thing I would do is look at your ears. So I'm looking at the shape of the ears. They aren't small, they aren't big, they fit your head shape. I don't notice any drainage or extra cercemen, or I don't know, cercemen, which is like earwax. When I look at the external ear, do you have any pain or tenderness when I pull on the pinna or push down on the tragus?
No.
Okay. And his ears are warm, the skin color is evenly distributed, and there's no masses or abnormalities. Okay, so now I'm just going to check his hearing really quick by doing the whisper test. So I'm going to whisper something on both sides of the ear, and then you tell me what it says. Okay?
Sure.
Today is Friday.
Today is Friday.
Okay, and I'll come around.
It's spooky season.
Yes, October. Okay, actually I'll come around and do that on that side because I just got cut off. Okay. Oh, what? No,
What?
just come this way.
Oh, okay.
Okay. Let let me say another thing.
It's cold outside. It is cold outside.
Okay, so everything's within normal limits here with your eyes and hearing. So that wraps up my assessment. All right, thank you. And then I'm going to perform my hand hygiene and leave.